Have you ever left a doctor's appointment feeling like you just heard a foreign language? It is common to feel a bit overwhelmed when medical professionals explain complex findings, especially after a procedure like a colonoscopy. But understanding your results is key to taking charge of your health. When doctors explain colonoscopy colitis findings, they typically begin by clearly stating that inflammation, or colitis, was observed in the colon. They will tell you the location and extent of this inflammation, and then discuss the next steps for understanding its specific cause. Colitis simply means inflammation of the inner lining of the colon. During a colonoscopy, the doctor uses a thin, flexible tube with a camera to visually inspect the colon for any abnormalities, including redness, swelling, or ulcers, which all indicate inflammation. To get a precise diagnosis and understand why the inflammation is there, small tissue samples, called biopsies, are almost always taken during the procedure. These biopsies are then sent to a pathologist who examines them under a microscope. The pathologist looks for specific cellular changes and patterns that can help pinpoint the type of colitis. For example, some types of inflammation are caused by infection, others by certain medications, and some are indicative of chronic conditions like inflammatory bowel disease or IBD. The doctor will review this detailed pathology report, along with your symptoms and medical history, to give you the most accurate explanation and recommend a personalized treatment plan. To help you grasp these findings, it is helpful to come prepared for your follow-up appointment. Consider bringing a list of questions you have, or even a trusted family member to take notes. When your doctor explains the findings, do not hesitate to ask for clarification on any terms you do not understand. You can ask what type of colitis was found, what its likely cause is, and what treatment options are available. Inquire about how these findings relate to your symptoms and what changes you might need to make in your diet or lifestyle. A crucial piece of the puzzle is the specific information in that pathology report. This report is a comprehensive document that details the microscopic findings, and it helps the doctor differentiate between various forms of colitis, such as microscopic colitis, ulcerative colitis, or Crohn's disease, which are all types of IBD. Sometimes, the findings might even indicate a non-IBD-related cause, such as ischemic colitis, where blood flow to the colon is reduced, or drug-induced colitis. Understanding these nuances helps your medical team, often a gastroenterologist working with a pathologist, tailor the most effective strategy for you. By actively engaging with your doctor, asking questions, and understanding the role of the pathology report, you transform a potentially confusing diagnosis into a clear roadmap for managing your colon health. This proactive approach ensures you are well-informed and empowered to work alongside your healthcare team to address any inflammation and maintain your well-being.